Creating hope together. Creating hope for Fife. The recent event, held at the Carnegie Conference Centre, was attended by 120 people representing over 50 services, organisations and projects from across the public, private and third sector. The event gave a chance to reflect on what's been achieved and bring people together to identify and prioritise the future direction of work. Lisa Cooper, Head of Preventative and Primary Care Services from Fife Health and Social Care Partnership, opened the event.
Today's event and the new strategy are about bringing people and organisations together, and this work could not be done without a collaborative approach from all partners and from all sectors in Fife. We're building on what we already have in Fife. This last slide feels very powerful. Hope is being able to see that there's light despite all of the darkness, and that's from Desmond Tutu. Suicide is an emotive and difficult topic, but through the work there's a lot of hope. Anyone could face a crisis point and life has many challenges. By bringing people together and working collaboratively to create a Fife suicide prevention action plan, we are raising awareness of the work, thinking about our contribution and helping others to find that hope. Thank you.
Those who attended also got the chance to meet and hear from individuals and organisations carrying out specific work around suicide prevention in Fife. We asked some of the partners who attended why the event and Fife's approach is so important.
My name's Louise Steen and I am the Our Minds Matter lead. So I'm an Education Development Officer supporting schools and education staff with early intervention approaches to mental health and emotional wellbeing supports. I think ultimately it's about coming together as a local authority and partner agencies, and because the Our Minds Matter approach really is about collaboration, we collaborate with our school nurses, our school counsellors, the CAMS and any other NHS partners, as well as all the voluntary sector. So really it's about building that early intervention support. We know that broad pastoral care and support is what supports our young people and families better than anything. We've heard today talking about peer support, so peers are really, really important. So I think, instead of just always focusing and medicalising the model and focusing on intensive care and support, which is of course needed, we really need to focus on that early, that base layer of support. So I think that's what's so great about this, is that we get to network with other services and find out who's supporting and who's providing what, and making sure that we're part of the discussion.
Yeah, so I'm Nicola Reid from Cruise Scotland, and we provide bereavement support right across Scotland. I think it's about the network for me and the collaborations and the partnerships that can come from that. I was involved in one of the videos for the fire service work, and I've seen really good models in Fife, and where the community of professional networks come together and really support each other and support people who are in real positions of crisis and real positions of, they don't really know what's going on. We're able to do the legwork for them because we know each other and we're connected to each other, and we can pick up the phone. I can pick up the phone to somebody whose name I know, and I know what they do, and that connection really does help support organisations and individuals.
My name is Alan Hutchison. I'm the manager of the Tay Road Bridge, and I represent the Tay Road Bridge Joint Board. I think it's important for events like this to take place, to bring everybody together so we can share our knowledge. There's an awful lot of people with knowledge that can be useful for other organisations. It's basically a learning hub. I think that's the most important thing.
My name's John Russell. I work for Bear Scotland South East and represent them and Transport Scotland, and I'm Suicide Prevention Lead for Bear Scotland. I think what we find is that the more information each of us has and share that information, the better outcomes we can get. So we work nationally with some of the other bridges and operators as well. So for example, Susie Haywood, who's here today from Public Health Scotland, she's asked if she can come along to one of those meetings, and it's just about sharing that information. And I think on sort of stats as well, we pass on a lot of information that we have at the Forth Road Bridge on a monthly basis as well, which gives us more up-to-date information that hopefully everybody in Fife can work on.
And we also asked, how do we create hope with what is such an emotive subject?
Well, I think it's important that we all recognise that we're all in this together, and that we're not sort of disparate organisations trying to cope on our own. And if we can come together and feel that sort of collective spirit of responsibility and to give us that drive to move things forward, I think that's got to be the best thing that comes out of today.
Sometimes I think that's all we've got. You know, it seems to we've got lots of processes in place, but figures are still high. And certainly some of the interventions I've done recently, hope is something that people are looking for. So if we promote that hope, then hopefully there's some outcomes that we can get from the end of that will help everybody.
Yeah, I think hope's a great word, because I think that's when people are in a place of despair, they don't have that, and we can be carriers of that hope for them, and give them those lights at the end of the tunnel, and that's great. And I think, you know, that's back to partnership and back to collaboration, isn't it? And yeah, I think knowing people and being alongside them, being in person with them is great, and it allows the remote connections to happen really well. So I think it's great that we've got opportunity to come together and put names to faces, put names to emails, and all of that kind of thing. So it's good.
So I think it creates hope because we're hearing people's personal stories about how they've thrived and how they've flourished despite suffering with traumatic experiences such as suicide. I myself have experienced, I've been bereaved by suicide through friends that I've known and acquaintances that I've known that have taken their own lives, and my own brother took his own life 6 years ago. So I've got a personal experience of what it feels like to be bereaved by suicide. I know how it feels to have almost that cluster bomb thrown into your family and wider community, and those little explosions continue to go off over the years. So I think it's really helpful when we look at people who can learn and give something back, and communities can thrive through sharing of experiences, and I think that's what creates hope.